Well, my friends, many of you, many of you have already seen the cases of urticaria. Urticaria. The other two names are hives or nettle rash. Nettle rash. There are various forms of nettle rash. I am showing some of the shapes from the Googles. It may appear anywhere in the body, everywhere in the body, a very disastrous conditions of the human being. Swelling, itching, burning, formication, etc. are the symptoms. So it is a condition characterized by transient wells, maybe due to skin reaction or angio type of edema or both. Various triggers can lead to the final common pathway of skin mast cell activation. When this occurs, the chemical secretions, histamine and other mediators are released, leading to local cell recruitment, enlargement, increase of the lymphocytes, vasodilatation, increase of the capillaries, increased vascular permeability, and sensory nerve activations become prominent. This is result from edema of the upper part of the dermis, I mean the epidermis. And angioedema involves a similar change in the lower dermis or to the deep of the dermis and subcutaneous. Now, based on the duration of symptoms, urticaria may be classified into acute urticaria and chronic urticaria. The acute urticaria must be differentiated from anaphylactic shock. If wheals or angioedema occurs with changes in other organs beside the skin, not comes under the acute urticaria. It belongs to chronic one. Chronic spontaneous urticaria involves the spontaneous appearance of wheals, angioedema lasting more than 6 weeks. However, this is a very distressing and annoying matter to everyone. Some antigens like foods are also responsible. The brinjal, the chickens or red meat or egg or prawns or sometimes lady's finger, drumsticks, etc. are responsible among the foods. However, in homeopathy, in allopathy, the treatment is also applications of histamine tablets, antihistamine tablets. In homeopathy, we treat the patient as a whole, and there are lots of improvement in our hands. This is a gentle lady, this handsome gentle lady having this urticaria, for which she had been suffering for last 5 years. Last 5 years. When the patient came, I took the symptomatology, craving for salt and cold drinks. Craving for salt and cold drinks. Fear of thunderstorm, sympathetic in nature, and some other symptomatology corresponded me to prescribe sodium chloride. So I simply prescribed sodium chloride with the direction twice in a day, and which is followed by sodium chloride in the next higher potencies, and now the patient has greatly improved from her long sufferings, more than 5 years, is totally removed. She is totally cured. So, is it not a scientific cure, a permanent cure, following the constitutional mode of treatment, which I have mentioned, after arranging according to me, named as Dr. Robin Burman's method of homeopathic treatment. Present complaints, past history, family history, personal history, the general symptoms, which are nothing but the classifications of 3 types: mental general, physical general, and after that peculiar particulars, and lastly the physical examinations, laboratory investigations, etc. And at last, over and above, the physician's own tact and talent, his own observation. Now, may I ask the patient how she has felt the improvement? আপনি খুশি হয়েছেন, ভালো আছেন?
ভালো আছি। আমি প্রচুর অ্যালোপ্যাথি ওষুধ খেয়েছি, ডেইলি খেতে হতো। তারপরে এখানে আমার এটা 3rd টাইম। তো ফার্স্ট টাইম ওষুধ নিয়ে আমার একটু একটু করে গ্যাপ বাড়তে থাকে। এখন মোটামুটি আমি অনেক দিনই অ্যালোপ্যাথি ওষুধ খাওয়া ছেড়ে দিয়েছি। আর অ্যালোপ্যাথি ওষুধে আমার প্রচুর সাইড এফেক্টও হতো, প্রচুর ঘুম হতো, চুল উঠে যেত, মানে অন্যান্য অনেক সমস্যা হচ্ছিল। তো আমি হোমিওপ্যাথি ওষুধ খেয়ে খুব হ্যাপি আছি, আর মানে মোটামুটি অনেকটাই সেরে গেছে আমার।
Thank you very much. And this is the reflection I want to switch over to the whole world, that homeopathy is not a mere of joke, not a folk medicine. Yes, it has the scientificity, it is a scientific mode of treatment, and every day we are curing a lots of diseases, my friends. But the system of treatment is only one: treat the patient, not the disease. Treat the patient, not the disease. And treat the patient according to holistic idea. Every individual differs from other individuals. So individualization is your theory. And for individualization, the first and foremost essential work is to case taking. A well-done case taking is nothing but half a cure of a patient. After proper case taking, by the format way, the present complaints, which is composed of the causation, location, sensation, modalities, concomitants, etc., then the past history, then the family history, then the personal history, and then the homeopathic general symptoms, considering the desire, aversion, thirst, sweat, appetite, sleep, dreams, thermal reactions, catches cold very easily or not, etc. And after that, you have to choose the medicine and removing the common symptoms, common ailments, and giving importance to the peculiar, uncommon, most striking symptoms which are not related with the pathology or the disease symptoms. You should choose your medicine, my friends. Thank you very much.